Have you noticed your dog hesitating at the bottom of the stairs? Or maybe they aren't the first one at the door anymore. It's easy to dismiss these changes as just slowing down, but they are often the first quiet signs of arthritis in dogs. Hi, I'm Lyndall from Vetster, and today we're talking about osteoarthritis in dogs. We'll cover the most common symptoms of arthritis, how a vet reaches a diagnosis, and what you can do to help your dog stay comfortable. As usual, all of the information in this video has been carefully reviewed by leading Vetster veterinarians. So let's get into it.
Arthritis is a general term that means inflammation in the joints, and there are several possible causes. Some types of arthritis are caused by joint infections, injuries, or problems with the immune system. But the most common kind by far in dogs is osteoarthritis. Osteoarthritis is a chronic progressive disease that happens when the cartilage inside a joint wears down over time. That loss of cartilage leads to pain, stiffness, and trouble moving. While it's most common in older dogs, it can affect dogs of any age, especially if they're overweight, have had joint injuries, or are genetically prone to joint issues. It's important to know what to look for, as dogs are experts at hiding pain. Watch for these specific symptoms of arthritis: limping or a change in how they walk, stiff joints, especially after resting, difficulty jumping into the car or onto furniture, reluctance to use stairs, slipping on hard floors, or muscle loss in the hind legs. You might notice your dog is slow to get going in the morning, but seems to improve once they've moved around a bit. If you see these signs, don't assume it's just old age. It could be a sign that your dog is in discomfort. Getting a proper diagnosis is the first step. A veterinarian will perform a physical exam and likely recommend X-rays. This is crucial because it confirms arthritis and rules out other serious conditions like bone cancer or ACL tears. In some cases, a vet might perform arthrocentesis, which is a medical term for taking a small fluid sample from the joint, or use advanced imaging like a CT scan. Once diagnosed, the most important part of treatment is weight management. Losing weight can actually have a bigger impact on your dog's mobility than medication. Think of it this way. If a 20-pound dog gains just 2 pounds, which is like a small bag of sugar, it's the equivalent of a human carrying an extra 15 pounds in a heavy backpack every single day. That extra weight puts significant stress on already inflamed joints. If you need a weight loss plan, a virtual vet on Vetster can help you get started without even leaving home. Your vet may also prescribe NSAIDs or non-steroidal anti-inflammatory drugs to reduce pain. It is vital that you never give your dog human painkillers like ibuprofen, Tylenol, or aspirin. Even a single dose can be dangerous, causing serious issues like kidney failure or stomach ulcers. Always use the specific medication your vet prescribes for your pet. Daily support can also come from joint supplements. These don't cure damaged joints, and results vary, but they may help slow progression and ease symptoms. Just make sure to use a product recommended by your vet, since supplements aren't regulated like medications. There are also specialized prescription diets designed to support joint health while keeping your dog at a healthy weight. These diets often include similar ingredients to joint supplements. But what's most important is that your dog's food is nutritionally complete and portioned appropriately to avoid weight gain as they become less active. Your vet can help guide you toward the right option. You can also make life much easier for an arthritic dog with a few simple changes around the home. Consider adding rugs or non-slip mats to slippery hardwood or tile floors. Use pet stairs or ramps so they don't have to jump, and consider a heated pet bed to soothe stiff joints. Just be sure to never use a human heating pad, as these can cause severe burns on dogs. Assistive gear like support harnesses, slings, compression wraps, or even dog wheelchairs can also help you safely assist your dog when they need to go outside or move around more comfortably. Movement is still medicine, but it needs to be low impact. Short, frequent walks on flat ground are better than one long hike. Swimming is also excellent because it builds muscle without putting weight on the joints. Some dogs also benefit from professional therapies like underwater treadmills, laser therapy, or acupuncture. Your vet may refer you to a rehabilitation center for these options. It's important to remember that while we can't cure osteoarthritis, we can manage it. It is a progressive disease, and it will worsen over time. By starting treatment early and sticking to a plan, you can add months or even years of high-quality, happy time to your dog's life. If you suspect your dog has joint pain, don't wait for it to get worse. You don't have to watch them struggle in silence. A virtual care appointment with a Vetster vet is a fast, convenient way to get expert advice and a personalized plan from the comfort of your living room. Thanks for watching. We'll see you in the next video. If you're looking for more information about dog mobility issues, check out our other videos appearing now. We cover everything from what to do if your dog is suddenly stiff or limping, to safe pain medications and what it means when your dog can't stand up or walk.